West Nile is a viral infection that first showed up in the United States about 15 years ago. It was imported from Africa. It's been well known in Africa for a long, long time, but we started getting some cases up in New York City around 2000, 2001, and it very quickly, over the course of about 2 years, spread throughout the rest of the United States. So West Nile is here to stay. It's not going away. It is now the #1 cause of mosquito-borne encephalitis in the United States. Only about 1% of the people who get West Nile have severe disease, and that's the encephalitis form. Encephalitis is an infection of the brain, and that can be deadly. We have about 120 deaths per year from West Nile in a country of 330 million. So it is less than 1 in a million people in the United States that die from West Nile. West Nile is spread by mosquitoes. So if you can lessen your chance of being bitten by a mosquito, you lessen your chance of being infected by West Nile virus. How do you lessen your chance of being bitten by mosquitoes? Avoid where they are. If you're going to be outside where there are mosquitoes, try to use some kind of a repellent. Anything with DEET in it. Spray it on your clothes does a great job of keeping the mosquitoes away. Also, try to reduce the breeding ground for mosquitoes. Mosquitoes like still water. Get rid of the puddles. It's those small standing areas of water where mosquitoes breed. And once they breed, then you've got the potential for having West Nile. Anybody can get infected. It's simply getting bitten by a mosquito that's carrying the virus. And a child can be bitten by a mosquito just the same as an adult can. But the vast majority of folks who get bitten never even know they've got the infection. The infection is subclinical, meaning there's no fever, there's no aches, there's no pains, there's nothing. They never know they've got it. The only way we find out that they've gotten the infection is by doing surveys of blood tests to see who's been infected in the past. And we find a lot of people who have been infected but never had any symptoms. The folks who are most at risk for severe disease, the encephalitis form of West Nile, are folks over age 65 to 70. Very few people under age 50 have severe outcomes from West Nile virus infections. West Nile activity peaks every year between about July and September. And according to the CDC graphs for this year, we've already peaked with West Nile. Our activity nationwide is on its way down substantially. So we are largely out of the height of the West Nile season. And even if we're in the middle of the season, most people do not need to have any undue concerns about West Nile, other than making sure you try to take some precautions against being bitten by mosquitoes.